Pancreatic cancer is often dubbed a silent killer, not just because of its deadly nature, but because it rarely announces its presence with clear early symptoms. This form of cancer hides behind vague and often overlooked signs, making it one of the most difficult diseases to detect in its early stages. By the time it's usually diagnosed, it has already progressed to an advanced stage, making treatment more complex and outcomes less favorable. At TrendPop, we believe that awareness can be a life-saving tool. That's why we've created this in-depth guide on 10 symptoms of pancreatic cancer that may seem harmless at first, but could be signaling something far more serious. Let's explore these warning signs that demand your attention. 1. Sudden and unexplained weight loss. One of the most prominent and worrying symptoms of pancreatic cancer is unexplained weight loss. When a person begins shedding pounds without changes to diet, physical activity, or lifestyle, it's a red flag. The pancreas plays a vital role in digestion by producing enzymes that help break down food. When it's compromised, the body struggles to absorb nutrients, resulting in unintentional weight loss. Additionally, the tumor itself can suppress appetite and increase metabolic demand. For some individuals, this might look like a few pounds at first, but it can quickly accelerate. In fact, studies have found that up to 50% of individuals diagnosed with pancreatic cancer reported noticeable weight loss well before diagnosis. 2. Persistent abdominal pain or discomfort. Another subtle but significant sign is recurring pain in the abdomen. This pain is typically described as a dull, aching sensation that may extend to the back. It usually originates in the upper abdominal area and worsens after eating or when lying down. The reason? As the tumor grows, it begins to press on nearby organs, tissues, and nerves. Because abdominal pain can result from many benign conditions, it's often dismissed or misdiagnosed. However, if this pain becomes persistent and is not relieved by standard treatments or dietary changes, it should raise suspicion for a deeper issue like pancreatic cancer. 3. Yellowing of the skin and eyes, jaundice. Jaundice is a visible and often alarming symptom of pancreatic cancer when the tumor blocks the bile duct, a channel that carries bile from the liver to the small intestine. It causes bilirubin, a yellow pigment, to accumulate in the bloodstream. This leads to a yellowing of the skin and the whites of the eyes, often accompanied by dark urine and pale-colored stools. In many cases, jaundice is one of the first noticeable symptoms, especially if the cancer is located in the head of the pancreas. If you or someone you know develops these signs without a known cause, immediate medical evaluation is necessary. 4. Changes in stool appearance. Pancreatic cancer can lead to significant changes in bowel movements, especially in the appearance and consistency of stool. If your stool becomes pale, oily, greasy, or floats instead of sinking, it may indicate a problem with bile flow. This symptom, known as steatorrhea, occurs when the pancreas can no longer produce enough enzymes to properly digest fats. Not only is this a sign of digestive dysfunction, but it's also a common early warning of pancreatic disease. If these changes are persistent, they should never be brushed off as mere dietary irregularities. 5. New-onset diabetes or sudden worsening of diabetes. The pancreas plays a central role in blood sugar regulation through insulin production. When cancer develops in this organ, it can impair insulin secretion and cause elevated blood sugar levels. In many patients, a new diagnosis of diabetes, especially after age 50 without any clear risk factors, can be an early clue pointing to pancreatic cancer. For others with existing diabetes, a sudden worsening of glucose control could indicate tumor activity interfering with pancreatic function. Medical professionals increasingly consider new-onset diabetes as a potential red flag for underlying pancreatic abnormalities. 6. Loss of appetite and persistent nausea. It's common for people with pancreatic cancer to experience a drastic loss of appetite. This can be due to the tumor putting pressure on the stomach or other parts of the digestive tract, leading to a constant feeling of fullness, discomfort, or nausea. Some may feel nauseous even when they haven't eaten. Over time, these symptoms result in significant nutritional deficiencies and fatigue. If you find yourself consistently uninterested in food or experiencing nausea without a clear cause, it's important to investigate further, especially if these issues are paired with weight loss or abdominal pain. 7. Constant fatigue and general weakness. Everyone feels tired occasionally, but cancer-related fatigue is different. It's overwhelming, persistent, and doesn't improve with rest. Pancreatic cancer can drain your body's energy reserves as it hijacks nutrients and disrupts your metabolism. Additionally, the physical toll of fighting an internal illness often causes emotional and mental fatigue. You may find it harder to complete daily tasks, stay focused, or even get out of bed. This kind of exhaustion is not something to ignore, especially when it comes out of nowhere and continues for weeks or months. 8. Itchy skin without rash. An unusual but telling sign of pancreatic cancer is itchy skin. This isn't the typical itch you get from dry weather or a mosquito bite. It's often deep, persistent, and may be linked to jaundice. When bile salts accumulate under the skin due to a blocked bile duct, they can cause a maddening itch that doesn't respond well to lotions or antihistamines. This symptom may be accompanied by other signs like yellowing of the skin or changes in urine color. Though rare, itchy skin should be considered significant, particularly when it appears alongside other symptoms of liver or pancreatic issues. 9. Persistent or worsening back pain. Back pain that doesn't go away and seems to radiate from the stomach to the spine could be a warning sign of pancreatic cancer. This type of pain is often misdiagnosed as muscular strain or a spine issue, but unlike typical back pain, cancer-related pain is deeper, constant, and doesn't improve with conventional remedies. It can become more severe at night or after meals. If you notice new or unusual back pain, especially when combined with abdominal discomfort, weight loss, or jaundice, it's important to talk to your doctor. 10. Elevated blood sugar without obvious reason. In some cases, individuals with no history of diabetes begin to experience unexplained high blood sugar levels. This sudden rise could be due to the tumor affecting insulin-producing cells in the pancreas. Monitoring blood sugar is especially critical for older adults who are otherwise healthy. Any unexpected spike in glucose should prompt further investigation, including screening for pancreatic or metabolic disorders. While high blood sugar alone isn't a definitive indicator of cancer, when paired with other signs, it becomes much more significant. Pancreatic cancer remains one of the most dangerous and elusive cancers, largely because its early symptoms are so easily overlooked. However, paying close attention to your body and recognizing these 10 warning signs could make a life-changing difference. Unexplained weight loss, jaundice, changes in stool, new-onset diabetes, and persistent pain are not issues to take lightly. If you found this video helpful, consider subscribing to Trend Pop and turning on the notification bell so you never miss out on our in-depth health insights. Let's continue this journey of awareness together, because staying informed is the first step towards staying healthy.